All right. So the agenda for today, as I mentioned before, Career Center services first. So let's get started. So we do offer career counseling services. You can make virtual career counseling appointments through your HANDSHAKE account, and you can ask us anything you need assistance with regarding your career development. We also review resumes, personal statements. We offer mock interviews, graduate school planning advice, job and internship search advice, so whatever you may need assistance with. We also have drop-in hours, which are Tuesdays, Wednesdays, Thursdays from 10 a.m. to 2 p.m. Those are shorter appointments, 15-minute sessions. So we limit the topics to resume cover letter critiques and job and internship search advice. We have a career guide, and you can access the PDF at the link in yellow. It contains great resume samples, interviewing tips, how to negotiate salaries, graduate and professional school advice, career exploration, career development advice. So make sure that you check out the career guide. We do have specific pre-health services. So as I mentioned earlier, we offer mock interviews, but not only for jobs and internships, but also for graduate or professional programs. So medical school, dentistry, physical therapy, occupational therapy programs. If they interview, we can prepare you for the interviews. We also review personal statements. Every graduate and professional program requires a personal statement, and we are here to help you with that. And we also have a variety of workshops that we offer each quarter. I'm gonna go over some of them in this presentation. These are pretty new resources for pre-health students. As I mentioned earlier, we have a pre-health at UCLA website that you can like and follow. We do post all our webinars there. You can find reminders of upcoming events there. So we are trying to make it very useful to you. We also post occasionally positions that are in HANDSHAKE that are healthcare related. We also have a pre-health at UCLA website, and that is more of an evergreen information. And we do have a tile for physical and occupational therapy with a lot of great information and links that you can find there. And you can also sign up for a pre-health newsletter that comes out bi-weekly. The first one just went out this Friday. The next one will go out on the 3rd, the 5th, and the 7th week of school. And all you need to do is choose healthcare as your industry preference on your HANDSHAKE account, and you will be receiving the newsletter. You can opt out anytime. Information sessions, they are virtual now, but companies do come to UCLA to recruit UCLA talent. So you can take a look at your HANDSHAKE account to see what companies are coming to UCLA. And it's not just companies, but also graduate and professional schools. For example, Columbia University nursing program was here the other day. So just make sure that you check HANDSHAKE from time to time to what's happening at the Career Center in our virtual space right now. And these are some of the targeted events that are coming up this quarter. So Med Mentor Mondays, they are first and second year medical school students from David Geffen School of Medicine, and they talk a lot, offer webinars on various topics related to med school. We have a guide to choosing an international medical school. We have finding research in the sciences at UCLA, and the hands-on healthcare virtual opportunities will be in December. MCAT and GRE strategy sessions. If you still need to take the GRE, we offer strategy sessions and practice tests every quarter. These are the dates for fall, and these are the dates for the practice tests this fall. So feel free to take advantage of that. The tests are free and online, and Princeton Review always raffles off 50% off their MCAT or GRE courses during their strategy sessions. Jumpstart series, you are in one of them, and we have another one coming up in end of October on optometry. We have a bunch of resources at your fingertips. Focus 2 is an assessment. Vault is a platform where you can research industries, companies. They also have a pretty robust job and internship database. Going global, if you're planning to travel abroad and you want to see, you want to find information at the places you planning on going, it's a great resource for that. Interview stream, you can practice interviewing skills, and VMOC is our newest addition. You can update your resume with the help of VMOC and hopefully get a much better result. And we also have online resources. I'm pretty sure you already heard about the UCLA one, which is our alumni community online. They also run a mentorship program. So if you're looking for a healthcare professional as a mentor, you may want to take a look at UCLA one. We also have online workshops on resume writing, career fair prep, and interviewing. And some of you may be graduating soon. So the good news is that you have access to the Career Center as a full-time student for an extra term. So if you're graduating in the fall, you can use us until winter, end of winter quarter. If you're graduating in winter, end of spring, and so on. Unfortunately, once that 3 months is up, you will have only partial access to the Career Center, and all the information can be found on our website regarding alumni services. We are all over the internet. As I mentioned, we are on Facebook, YouTube. The Career Center revived our YouTube channel. We post all our webinars, not just the healthcare ones, healthcare related ones, but every webinar that we have conducted in during spring and summer, you can find there. And Twitter and Instagram and LinkedIn. And this is just something I found online, so I found it useful. So I thought I'm going to include it in this presentation. So what do physical therapists and occupational therapists do? So some of you might still be in the career exploration stage, and you may find this post helpful. All right. If you have any questions, please feel free to post it in the chat box. I will be happy to answer any questions I can get. And once we start the presentations, if you have a question to the presenters, you can put it in the Q&A. Okay, so I'm gonna stop share for now and invite Goretti, who is here to represent Spot. And
hi everyone. Okay, I'm just gonna share my screen real quick. Oh, that's the email. Okay, is Andy a panelist now?
Not yet. Hi.
Oh, you are Grad
but he's there.
Okay, that's okay. Hi everyone. We're from SPOT, the Society of Physical and Occupational Therapy at UCLA. My name's Grad. I'm the Community Relations Officer.
And I'm Andy. I'm this year's president.
Yeah, so we're the only physical and occupational therapy club at UCLA. So if you're interested in joining this PowerPoint, we'll have like all the information you need.
All right, so we're just gonna breeze by our meeting agenda. We just have what SPOT is, how to become a SPOT member, and what do we do, a little bit more of a deeper dive into what PT and OT is, and then we'll wrap on up.
Okay, so our SPOT pillars, in our org, we have a lot of things that we like to follow just so that our members get the best experience possible. So informational guidance, our goal is to kind of just give members a deeper understanding of what PT and OT are as fields. Like for example, I came into UCLA a PT, pre-PT, but just being in SPOT, it really opened my eyes to like both fields, and I realized it was a better fit for me to do OT. So we do that. A hands-on experience with COVID, it's obviously different than previous quarters, but we are trying to find virtual experiences. I know Andy already found like a virtual PT shadowing experience, which is really nice. And we also have organizations like Keen LA, which we'll get back into later. Grad school readiness, just a lot of our alumni, we like having them back just so they give us a very honest, just like admissions process spiel, and just connecting with career centers in this way, and GRE resume workshops. So that's a little gist of our pillars.
Cool. If you aren't already a member, we just want to encourage a lot of y'all to come on out. We meet on Mondays from 8 to 9 p.m. We encourage everyone to go ahead and show up to both OT and PT meetings, especially if you're undecided as to which one specifically. But if you have an idea of what you want in mind, whether that's PT or OT, then you can definitely attend just the specific meeting that you're interested in.
Mm-hmm. Yeah, like I said earlier, I feel like a lot of you are already in SPOT, but if you aren't, there will be information on how you can join. So next, this is just our SPOT board. We won't go through this too much, but basically, I love SPOT because there's a lot of ways to get involved. Like we had a lot of new positions made just because there's a lot of things to do, like find speakers, network with professionals. And so if you are in SPOT for a while and you want like professional experience, leadership experience, it's an amazing way, and I love it for that.
All right, so I'm going to expand a little bit more on the pillars that you already talked about before. One of the main things is informational guidance. The biggest draw of SPOT, at least to me and other members, is that we bring out professionals and student PTs and OTs to come and talk to our club. So if you are more interested in general OT or PT, or maybe more of a specific niche, like, I don't know, travel PT or manual therapy, et cetera, we've brought speakers out from those various fields. And then as Grady was saying, although COVID's a little weird, prior to this year, we would take a lot of our members on field trips to visit the potential graduate schools. So you see PT programs, OT programs, et cetera.
So hands-on experience, like I said before, COVID's weird. Everything's weird right now, but we're still doing Keen, which is amazing. Keen is an organization that works with just individuals with disabilities, and in the past we played basketball with them. You can see Andy there in the middle. This year it's also virtual, so I believe we even have an event coming up this Saturday. So if you need volunteer experience virtually, it's an amazing way to get involved. And yeah, we're still searching for more experience with COVID and everything, but if you're a member, we do have updates and we give you opportunities when they arise.
Last but not least, in addition to bringing out professionals and students to come and talk, we have grad school readiness prep. So I think last winter quarter we had Princeton prep come out and talk about like the GRE. In addition to what the Career Center already does. That's just a great supplement. I think they had actually been to the Career Center that prior morning, so they just went ahead and jumped by and stopped by SPOT as well. So we do stuff like that in addition to private resume review workshops and more stuff like that.
So if you're here, I feel like you may already know, but I didn't really know what OT was before I joined SPOT. So physical, do you want to go? So I'm OT and Andy's PT, so maybe he can talk about PT and I can talk about OT a little, but also our panelists are very knowledgeable, so I'm sure they'll go into more detail, but we can just give a quick spiel right now. Andy, do you want to do PT?
Yeah, sure. I think the general thing is, the general definition right here is pretty good. Working primarily with people recovering from injuries and to get people back into motion with exercises, massage, and other techniques, including but not limited to exercising, massaging, as they were saying, and other modalities that might be electrical stimulation and other niche things that you'll see in a clinic.
Yeah, and OT, I feel like they deal with a wide variety of individuals. In my experience, I've helped work with kids with disabilities and just perform like everyday tasks, so like occupations, and just like get them back to doing what they like to do before if they had the ability to do so before. I'm sure it'll be explained later in this webinar, but yeah, moving on.
In case you all are interested, we have these QR codes for Spot PT and OT. As Grady was saying earlier, we have kind of a large alumni network that we're kind of working on building. So once you graduate, you can still feel free to be a part of these group meetings and provide some more needed knowledge and insight for our upcoming members.
Oh, before we continue, this is exciting information. So in the past, we have been SPOT, Society of Physical and Occupational Therapy, but some of you may know if you've shadowed in some clinics or something, that the OTs and PTs also work very closely with SLPs, which is speech language pathologists. That's a mouthful every time. And so just if you don't know, SLPs work with people of all ages and help treat many types of communication problems and swallowing problems. And these problems include speech sounds, language, literacy, social communication, voice, and fluency. And they just do a bunch of exercises to help, just kind of help language and stuff. And in my experience, I've seen a lot of kids do it, but I'm sure adults need practice with it, especially if they start to lose their, their language abilities. So yeah, that's exciting, and we're thinking of expanding, and we want more speakers and more info about this for some of our members because it was requested. So yeah, stay tuned for that if you're interested.
Awesome. Just for those of you that are interested in the logistical side of things and how to get to physical therapy and occupational therapy schools, first and foremost, you don't have to be a particular major. Yesterday, we actually had a general OT lecture from our advisor, Andrew, who works at UCLA. He actually graduated with a dance and political science double major. So there is no one shoe fits all, I guess, in regards to becoming a PT or an OT, but there are prereqs that you have to take, including anatomy, physiology, and bio. And then the GRE, which was mentioned earlier, is kind of the graduate exam. It encompasses a lot of professions, and the scores that you're kind of aiming for are above the average, which is around 150 plus for each section, one for verbal, quantitative, and writing. And then letters of recommendations from PTs and OTs that you work in or work with in clinic, a professor or two, and then another reference from maybe a job or another professor in addition. And then last but not least, we have observation hours. The recommendation is that you do 100 more, the more the merrier, but definitely in a variety of settings, whether that's pediatrics, inpatient, outpatient. Try to spread out your time and show that you really care about the profession.
Yeah, also this is just general information. It just varies by school. I don't know if
I think
would
Grady
like
might
in
be
admissions.
cutting out.
Oh no. Do you hear me now?
Yeah, you're back.
Okay. Okay, I don't know what you heard, but we can move on. Okay, am I cutting out still?
You're good.
Okay, so this is just a pre-health requirement given out by UCLA. As you can see on the right side, there's physical therapy. I know occupational therapy also requires human anatomy and physio for a lot of schools as a prereq, and this is just like a general guide, but really don't take it too, really look into the school that you're planning on attending or planning on applying to. I know that over here, this amount of OChem is not required for some, so just really look into it. But this is a standard guide for pre-health. Oh, skip that.
Okay, and then in regards to our upcoming meetings, as I was saying earlier, we meet Mondays from 8 to 9. Feel free to email this email right here, uclaptclub@gmail.com, to be added to our newsletter. We send out a weekly newsletter every Friday to let you all know what happened the previous week and what we're going to be doing that upcoming meeting. Yeah. Next slide, get ready.
Okay, so if you want to join, we're trying to do a lot of socials, online socials, because of the virtual learning. Yeah, we're trying to, even though it's about professional development here, we also want to establish community where we're all very supportive of one another and help applying to OT and PT school. So Yeah, I hope you join our club so we can have fun together. We like to play Among Us. So that's another thing. And Andy, do you want to finish us off?
Yeah, like I was saying, you can email uclaptclub@gmail.com for any more questions. You can find us on Instagram at UCLA Spot. This is forget what the app is called, but if you send a text to 81010, you'll be added to that app and get notified for meetings and stuff like that. And you can also find us on Facebook. But thank you for your time, everybody.
Thank you.
Thank you both. Thank you. Do you mind sharing this presentation with me so I can include it in the follow-up email?
I will email it to you.
All right. Thank you so much. Thank you. Next up.
Unshare.
Yeah. All right. Next up is Casey Pollard, who's here from Samuel Merritt University. Casey, I hope you're ready.
I am, yes. Hello, everybody. I'm just going to go ahead and get my PowerPoint up here. Just one moment. Bear with me.
All right.
And
while Casey's getting ready, I just wanna launch a couple of polls. I hope I have them, so we can see who's in the audience. Do you guys mind filling this out so we can see who is in the audience? All right, we had 87%. Come on. We can do better than that. Perfect. So mostly juniors and seniors, but some freshmen and sophomore. Awesome. This is the results. All right. And then we have one more. Who's interested in what? Okay, 81, 93, awesome. There is always one person who's holding up. All right, so here is the results, pretty even. Not sure, great career exploration, awesome. All right, so now we have a little knowledge about our audience. Casey, you ready?
yeah.
All right, take it over.
All right, and you all can see my screen there. Let's see. Can you see my screen,
yes,
Christina?
Yes,
okay.
We can.
Okay, great. Thank you. All right, well, let me go ahead and jump in. Hi, everybody. I'm Casey. I am an admission counselor and recruiter for both our physical therapy and occupational therapy programs at Samuel Merritt. I've been with Samuel Merritt for about 14 years, so if you have a question, I most likely know the answer or can definitely find it for you. So let me know. I will give you my contact information at the end of this slideshow so you can contact me if you need anything. Let's see here. Getting technology to cooperate. Here we are. So a little bit about Samuel Merritt, and then I'll go more specifically into our OT and PT programs. So Samuel Merritt as a whole was founded in 1909. So we've been around for a long time. We've got it figured out. You will not be a guinea pig. We have long standing programs with extraordinary success rates. So again, you will be in really good hands with the well-established program, whichever PT or OT program that you choose. And Samuel Merritt offers only health sciences, so that does offer some interprofessional clinical education. We try and keep all of your classes very specific to either PT or OT to give you the respect that your chosen specialty, your profession deserves. But at the same time, being out in the field and working as either a PT or an OT means that you will need to learn how to coordinate and collaborate with other medical professions. So that is something that we are able to offer you. All of our classes are really small sized. So our PT class is maximum of 50 students, and our OT class, which is MOT and OTD combined, is only 42 students. So our classes are kept very small to give you a much more personalized education, and our curriculum is really tailored to our students. We listen, ask for, and really take action on student feedback. It's a really important part of our programs. We are an affiliate of Sutter Health. That only matters to you because that means we have a massive liability insurance coverage. So we are able to send our students, we have over 250 clinical sites within California alone, and then more all over the country. And if there's somewhere where you really want to go, we can pretty easily establish an affiliation agreement. That being said, to allow you to attend that facility. But that being said, your clinical assignments and rotations are all pre-assigned, so you don't need to scramble and try and find those. Our graduates earn among the top 20, probably top 10 at this point, California alumni salaries. So our graduates do really, really well. And a good reference for you is www.collegescorecard.ed.gov. That's just a really good way to compare different programs and salary ratios, debt ratios, those types of things. So good resource there for you. So overall, the PT and the OT programs are pretty similar in that we are highly invested in the overall mission statement of Samuel Merritt. So here, it reads, Samuel Merritt University educates students to become highly skilled and compassionate healthcare professionals who positively transform the experience of care in diverse communities. In a nutshell, Samuel Merritt University wants to make healthcare equal and available for everyone. Unfortunately, that is not the day and time that we are in. So we work primarily, or we really focus our energies on working with underserved and underrepresented communities in order to sort of bridge that gap to make healthcare equal and available to everyone. So you will have opportunities to work with homeless populations all the way up to, probably celebrity children or, what have you. So either profession, your patient presentation, especially we're in Northern California in the Bay Area, is huge. So you will see anything and everything that you could ever dream of in our patient presentation, being that we are part of such a diverse community and we are intentionally inserting ourselves into the community in order to try and make as much of a difference as we can. I mentioned earlier that you will have some interprofessional experience within our programs, whether it be the MOT, OTD, or DPT program. So we offer, plethora of nursing degrees. That's where our undergraduate comes in, all the way up to the doctor, DNP of nurse practice. We offer both an MOT and an OTD, as well as our DPT, our Masters of Physician Assistant, and then our podiatric medicine programs. So those, you will have some clinical exposure as well as some classroom exposure with the OT and the DPT programs, and then as well as the DPM or the podiatric medicine program. But we did experiment with the interprofessional model in the classroom setting, and our students did not like it. So we really, again, listened to the feedback from current students and previous students to really make sure that we are offering and aligning ourselves with best learning practices. So while you will still have some classes with either MOT and DPT or DPM, but your primary focus is going to be on your particular chosen path to make sure that we're really honoring your time and efforts in the program. Our health science simulation centers, you'll start out in either program working in the first year in our health science simulation centers. And I think even though these are pretty outdated photos, it's just a little bit of a glimpse of the technology that is offered that really allows you to advance in your profession at a much quicker rate than many other programs, simply because you are learning and practicing hands-on what you're learning in the classroom. And that makes such a difference. It's really proven to be among best learning practices, and that's something that we want to ensure all of our students are able to receive, even in COVID, even with everything that's going on. Because we have our health science simulation centers, we're able to create any scenario that you would see out in the field and bring it to you in a really safe learning environment, where not only will you be confident to make mistakes, do really well, but you'll get feedback and you'll have a lot of support. So initially you'll start working with these mannequins or these patients here. And in our sim centers, we can simulate the labs to look like a hospital setting, emergency room setting, clinic, a doctor's office, what have you. And then your professor will be here in the control room in that round photo there. And there, again, these are somewhat outdated, my apologies. But you'll be able to see, working with the faculty, they get to talk through that patient. They get to make the eyes blink, the heart rate, everything. So you're in a very realistic learning environment right from the start in either one of our PT or OT programs. So again, we can make the sim labs look like emergency rooms, any type of setting, to really allow you the best opportunities to learn in a controlled and safe environment. So our graduate health professions, we offer again both OTD and MOT. That is our OT program. So I'll talk a little bit more about that as we get into OT, as well as our DPT programs. And there, again, there are a lot of similarities between the two. So as a PT or OT student, you will be running our pediatrics clinic as part of your curriculum. So we offer 3 pro bono clinical opportunities that are free to the community. And what's unique about that is that there are many programs that are affiliated with clinics, but Samuel Merritt allows the students to run the clinic and the faculty to observe. So that is a very unique component of the hands-on clinical experiences that you will get. And again, these free clinics are a way to reach out and provide care to community that otherwise couldn't afford any care, much less the type and quality of care that you're able to provide as a Samuel Merritt student. So it's a really, really rewarding thing to be involved in, especially so early on in your education. So again, the students in both our MOT and OT programs will also be running so there is a pediatrics, an adult, and a psychosocial clinic. So those are clinics that you as students will be in charge of running, and you will have the full support and supervision of the faculty. So those are things that will mostly take place on campus. Especially during COVID. So we are still able to offer those clinical opportunities, but we are doing so in a more condensed, smaller group, and obviously personal. The PPE protection is a must. So we have definitely made adaptations to the current COVID conditions, but we're still able to offer you hands-on learning. So that's a really, really big deal. Occupational therapy. So these are some students that are working with a little kid here from the pediatrics clinic that is on campus. So that's just a little glimpse into the type of work that you would be doing in your start with the program. You do start your hands-on clinical experience in the OT program in the first year. So let me talk about the mission statement, and then we'll talk about the MOT and OTD confusing component. I know it's on everybody's mind. So, but the OTD not only is the overall mission of Samuel Merritt really important to OTD, but also the OT program vision statement is very important. It is something that we operate and realign with very often to make sure that we're really, again, offering not only best learning practices, but we are committing to transforming you into really successful, really compassionate OTs that are willing, able, and compassionate about working with patients from all walks of life. So the vision statement reads, we will be an innovative doctoral program preparing students to provide exceptional holistic occupational therapy to meet the evolving needs of society. And that is also the same of our MOT program. And so the confusion is that we offer both the MOT and the OTD program. The reason for that is that initially the AOTA, or the American Occupational Therapy, had mandated that programs train at the OTD level, the entry level Doctor of Occupational Therapy. And then they said, just kidding, you can still get your master's and carry on and become just as successful within the field in occupational therapy. So we decided to offer both degrees to really meet the needs of not only the profession, but of you as a student. So for the first 2 years, you will go through the program all together, MOT and OTD. Again, that is a total of 42 students for the combination of both. It gives the MOT students somewhat of an advantage because they are learning somewhat of an advanced curriculum. And then the OTD students will do additional classes in leadership and the likes to carry on and do an additional year for the OTD program. So the master's is 2 years, the OTD is 3 years. Okay, but you'll sit together for the first of those 2 years. Okay. So again, just kind of a recap here. Students will complete an additional semester and then a 6-month clinical internship for the OTD program after those who have done the MOT program have already graduated. So 2 years together, and then the 3rd year, the OTD carry on by themselves as a cohort. So we have made some updates to our curriculum as well as our prerequisites for fall 2021. The deadline for our application for OTD is October 15th. I am really pushing the faculty and OTCAS to allow us to extend our deadline. I'm hoping till November 1st, possibly even November 15th, because I've had a lot of emails from people saying that they have had a really tough time submitting via OTCAS and there's been some glitches. So if you're having experiences like that, you are not alone. So we do not require OT hours of observation. If you're able to get those virtually during that time, that is excellent. We will accept those, but we're not requiring the observation hours nor the letter of recommendation from an OT. The 3D skill or craft class that used to be required is now recommended. And we used to have some timelines on the biology and physics requirements. Depending on when you were applying, you would have to have those completed. And we've just allowed you now to have those completed before you actually start the program. So there's some extra time to get the biology and physics requirements completed. So if you have questions, check out our website, which I'll give you more information about, or go ahead and send me an email. I'm happy to work with you one-on-one to answer any questions. Okay, so the deadline as of now extended to October 15th. Hopefully we'll extend that a little bit further for anyone with applications in progress. So as you all know, and Andy and Grad did a really great job of kind of highlighting the differences in professions. And I really recommend that you get involved in clubs like that because they are such a powerful way to get involved with other people who may hear more about what's happening in the OT or PT world than you do. Gives you a lifeline, gives you a network, and it sounds like they have some really awesome opportunities and tools to provide. So definitely get involved in those if you can. So I'm sure if you're interested in OT or you have been interested, people are asking you, so are you going to be a job counselor? Are you finding people jobs or as an occupational therapist? And no, you are all learning or already know that PTs work with patients across the lifespan to participate in everyday activities. So there are jobs in school systems, hospitals, rehabilitation clinics, home health, psychiatric. So the profession is really, really expanding. And the fact that there is an OTD, entry-level doctor of occupational therapy, even existing, is a really big deal. Started as a bachelor's degree, went to a master's degree. Now there's an OTD. And that is excellent news for the profession being taken seriously. I know I'm getting a little bit close to time, so I'm going to speed it up here a bit. So the OTD, again, masters and OTD are combined into one cohort, which caps out at 42 seats. So very small and intimate class size. The MOT program is completed in 7 semesters. The OTD program is completed in 3 years, including summers. During the second year, you'll complete a 6-month clinical internship working in the field. Both MOT and OTD start out with fieldwork in your first year in summer 1, and then for MOT summer 2, and then for OTD will also be summer 3. We run 3 free community clinics in pediatrics, adult, and psychosocial. It says here majority of the OT faculty practice in the field, and I'm almost positive that all of the faculty work still in the field. So, and they have specialties pretty much across the whole spectrum. So if there's anything that you're particularly interested in, I can bet that we have a faculty member that specializes in it or has specialized in it and more. So not only are you assigned a peer mentor when you begin the program, you're also assigned a faculty mentor. And then if there's somebody that has a specialty that you are particularly interested in, you can also work with them to help further that specialty or career path choice. All right, we have a very high NBCOT is the national board exam to sit to get your license to operate or practice, excuse me, as an OT. And so our pass rates have been at 100% for numerous years. And then our student to faculty ratio is 1:9. So you'll have a lot of hands-on attention in both the MOT and the OTD, as well as the DPT program. So small class size, I think, lends a big role in what makes us not only such a very competitive program, but very comprehensive. So our graduates leave and they're, very highly desired out in the job market. So the OTD prerequisites, I'll let you guys maybe take a screenshot of this. So we don't want to spend too much time. You can find all of this online. And again, you're more than welcome to email me if you have questions. So I will keep an eye out for any emails or questions on that. But 2 English courses, it could be English composition, critical thinking, essentially anything in the English department. We also take AP English. We will also accept AP psychology. So if you've taken any AP classes, we will accept those. Especially for the non-sciences, pass, no pass is fine. We do want to see your letter grades in the science courses because of the science GPA that we look at, and we'll talk more about that later. But because there are 4 sciences within this prerequisite list, biology, physics, anatomy, and physiology, if you have a lower overall science GPA, but good grades within those 4 prerequisites, then we can override that lower overall science GPA. So just a little tip.
Casey, your time is on. Your time is almost up. So if you can wrap it, please.
Yep, sorry about that. So for anybody who is not able to, I've gone over my time and haven't gotten to the PT yet. So let me just skip forward to our contact information. And then I'm also offering live chats every Wednesday and Thursday for both our PT and our OT programs. So what I would suggest is I'll come back to this slide. This is important, but let me give you the contact information so that you can reach me or attend one of my live chats. So this Wednesday, let's see, yes, tomorrow at noon, I'll have my my DPT live chat hour, and then every other Thursday, I will have one this Thursday at noon as well for the OT live chat hour. So you can come there, ask any questions. It's the same room for either. So anytime you'd like to go to either of those chats, you can just log into my WebEx room and attend any of those. And then if you need to email me, here is my email address. So klemmer, KLEMMER @samuelmerritt.edu. Can you reach me personally? If you have general questions, you can email the admissions address, but I would recommend just emailing me directly, and you can put in UCLA presentation question in the subject line, so I make sure to know to follow up with you right away. So again, sorry for going over my time there. I got a little excited.
No worries. Thank you so much for sharing. And you have one question in the Q&A. You can answer it in the Q&A if you don't mind. And I just want to check in with Tony and Heather, who wants to start the LLU presentation.
Let's have Heather start because she's got a video that encompasses the rehab.
All right. So Casey, if you stop sharing,
there we go.
then we can have Heather start sharing. And if you share your presentation, I can also add it to the follow-up email. And welcome Heather and Brian from Loma Linda.
Okay. It'll just take a second for this to pop up here. Can everyone see the screen now?
Yes, I can.
Here at Loma Linda University, I'm training to be a part of the rehab team. This includes physical therapy, occupational therapy, and speech and language pathology.
Physical therapy helps patients by promoting mobility and stability, reducing pain, restoring function, and preventing disability.
Through creative problem solving, occupational therapy helps people across the lifespan to participate in their meaningful everyday activities, regardless of disease or disability. They strive to understand the whole person, including habits and routines, to help develop their skills for the job of living.
Speech-language pathologists work to help kids and adults communicate effectively so that others can understand them and they can understand others. They also work with individuals who have feeding and swallowing problems.
Being part of the rehab team is an amazing experience because I get to help the athlete get back on the court.
I give someone the chance to become independent again.
I work with an elementary school student to make them confident when communicating.
At Loma Linda University, all three programs have been around for more than 55 years, preparing students to make an impact on individuals' lives through compassionate care.
The rehab programs are housed on one campus, allowing opportunities for interaction and collaboration. In the classroom, I feel like the professors really care for us and want us to succeed.
They also provide learning experiences outside of the classrooms with interactive labs and a variety of clinical sites.
I really enjoy the campus life here at Loma Linda.
We are encouraged to live a balanced life through spirituality, exercise, diet, and social activities. This emphasis on whole person care is something that sets Loma Linda apart.
Loma Linda provides service learning opportunities that continue the teaching and healing ministry of Jesus Christ both locally and internationally.
Faith is infused in all aspects of Loma Linda. From professors praying in the classroom to the weekly university-wide chapel service, I'm reminded every day of what's truly important.
Loma Linda is a unique place.
It's the emphasis on whole person care.
It's the many ways to gain service learning and clinical experience.
It's the faculty, staff, and classmates who help me succeed every day.
And it's you who will come to Loma Linda University and help us make an impact in our communities and around the world.
There, thank you so much for for this chance to watch the video. Let me now get over to the PowerPoint. Dr. Valenzuela, do you want to go ahead with your part, or do you want me to just go ahead with OT? All right. All right, so thank you so much for having us here. My name, let me get us all the way back to the beginning here. Hold on one second. Let's get a backwards preview. So my name is Dr. Heather Javaharian, and I'm the program director for the Masters of Occupational Therapy program here at Loma Linda. And Brian, do you want to give a hello so you come to the screen if they have you in speaker view?
Hi guys, I'm Brian. I'm a second-year OT student.
So thanks so much for being here, Brian, to share. And he will be able to answer a lot of questions from a student perspective. So we wanted to begin, you heard from the other speaker just about what is occupational therapy, and it is confusing, but it's so broad. I think that's the exciting part of it. So according to our professional association, we have several different focus areas, and here are the main ones. The first one is children and youth. So if you enjoy working with kids in pediatrics, could be a school-based setting, it could be in the NICU, it could be in outpatient clinics. Often we think of occupational therapy with sensory integration in kids, and you think of us playing in the balls, kids on boosters, going down obstacle courses. Yes, that's OT, having lots of fun. Also, if you're interested in healthy living, health promotion, wellness, occupational therapy could be for you. We look at behavioral health or mental health as another significant area of practice for us. So OTs can be employed in behavioral health centers, in hospitals. We work with people who have anxiety, depression, and then your more significant conditions that may be schizophrenia, bipolar disorder, and all, multiple personalities, all of those. So if you're interested in kind of that psychology aspect, OT could be for you. But I do emphasize that when you are working with people who have disabilities, regardless of the area of practice that you see here, mental health really is important in all of those areas because their life has been changed as they face disability, disease, terminal illness. So it's really important to bring that part into your practice. We work with people who are aging, and especially with older adults, we get to come up with creative strategies to help them age in place. So where do they want to live as they age, or as they get older and our bodies change? How do we keep doing the things we want to do? How do we keep participating and stay healthy? And then disability and rehab, that's kind of your traditional areas of practice, hospital settings, could be acute care, intensive care, your inpatient rehab centers, your outpatient rehab centers, hand therapy, and all of those. And work, this one always makes me smile because often people, if you tell your parents like, oh, I think I want to go into occupational therapy, do they often say, oh, so you want to help people get jobs? Well, you could say yes, actually, because we do that in OT, but it's just one small part of it. Brian, maybe he'll share this a little bit later, but he actually was part of a small group, just 5 other students who got into ergonomics for his fieldwork experience. And Brian, did you give a presentation to like 180 or so dental students, OT students, deans, faculty?
Yeah, it was I think all the first year dental students, and then our class OT students, or it might have actually been all of the dental students for that matter, because it was just ergonomic evaluation of their learning situation because everything got transitioned onto online. So we had to also edit our field work, but it was an opportunity to adapt to the situation, but make most of it as well by helping the dental students maximize their online learning without getting hurt and hurting their back, and just, yeah, giving them the best opportunity to learn.
Yeah, it was an incredible experience, and not to brag too much, but just thinking Brian was a first-year student in the program. He'd been in for a couple quarters, but still, he and his colleagues did an amazing presentation, very professional in what they were able to share and educate others, over 180 others about ergonomics and safety. And then the last area we have from our profession is driving, and that's helping people to drive safely. So regardless of the condition they have, how do we adapt the vehicle to keep them driving? And then how do we screen people, especially if you think of aging population, so that they're safe drivers? So here are some pictures, because sometimes pictures speak louder than words. So let's start maybe here in the middle. There's this infant in NICU. That's where you might be working with mom and dad, teaching kangaroo care, maybe teaching one of the caregivers how to do infant massage so they can bond with the infant. And then of course, is supporting its normal development. You may work with, again, aging in place here on the right, and you see this, external fixation. So maybe you're working in a hand therapy center and you're gonna be working on range of motion, modalities and such. It's my stepson here in the middle at a beach, because that's trying to capture, as I think one of the earlier presenters said, helping people to engage in meaningful occupation. So it's not just his academic performance and supporting him in school and including him in that academic setting, but it's also working with children and youth and their families to support meaningful occupation. On the left, this is an older picture of Mike. I need to get a new picture because I'm like, Mike, it's hands-free driving. You can't be holding your cell phone. But Mike comes to our School of Allied Health once a year and shares his story. He lost all 4 extremities when he was in a coma, was ill, and they had to amputate it. And then he, woke up to losing all 4 limbs, and he shares his experience. And this is not in a book for PT, it's not in a book for OT. When he comes into your clinic, this is really using your therapeutic rapport, your creativity to say, okay, my goal is to help him get dressed. How is he gonna give himself a bath or a shower again? How is he going to eat? Oh, I need to work with orthotics and prosthetics. PT is gonna be working with him and doing a lot of strengthening and all sorts of things. But I think for us as OTs, it's really figuring out how does he get back in life. He's also a dad. And I can bet his wife wanted him to be involved. Like, how do you change diapers? He had to be involved in that parenting role too. So that's kind of the fun creativity of OT, and then of course end of life care. So our curriculum has 10 quarters. We look at, first we could begin with behavioral health. And again, think back to Mike, when you have a disease, illness, condition, that mental health piece is there regardless if, just regardless if they actually have a mental health diagnosis. And then we move into orthopedics, neuro, pediatrics, and gen med. And so, Brian, do you want to talk a little bit about some of the learning experiences?
Yeah, so Loma Linda takes great importance in doing hands-on learning and offering that to the students. So some examples are like in mental health, behavioral health quarter, you get split up into small groups where you get to host or get to hold a mental health therapy session, a group session. And it's not like a typical, group activity, oh, just go practice your skills. This is a group where you guys agree to confidentiality, where it's a safe place to share. So the student that gets their turn to lead the session, they get to really practice, adapting to the emotions that might come out from sharing things from the past, and also for the students to also, have a chance to express their emotions and to have things come to light and to deal with it. So it really bonds the group together. It gives you a really like an accurate lookout to what you can expect, or like a taste of what you could expect. And it's not just like a small group activity that you do in class. Other activities vary, other labs vary from splinting lab, pediatric lab, and they're all very immersive. You get the materials, you get to really, you get to make splints, you get to play with the pediatric equipment, and there's just a lot of opportunity. And also the professors always like to incorporate, even when it's a lecture, they're like, okay, let's take a little break and let's really incorporate what we learned. Let's practice on each other. So even during like sit down lectures, there's always great opportunity to really engage in the skills that we're learning. And yeah, you're just always learning, which is really cool. And for me, I'm more of a learner from doing rather than just watching lectures. So it's been really beneficial to me. And Loma Linda, as you know, is the school's a religious background. So mission work and volunteering seem well related with religious schools. But with Loma Linda, it's mainly, or it's a big medical school where there's a lot of different disciplines where you get to learn, or where there's a lot of disciplines working together and learning together. So Loma Linda offers a lot of mission trips to Haiti, China, South America, Samoa. The list is quite long. And it's offered every quarter, I believe, but there's a lot during summer. And with that, the mission goal, I heard from people that have been to missions, it kind of changes depending on what fields attend the mission. So if it's a lot of nurses, it'll be a lot of health education, doing little minor treatments, holding health clinics. And if it's like dental students, they do, more dental focused, and occupational therapy, physical therapy, same thing. And it's just a great way to connect with other disciplines, but also to help the underserved areas. And not only helping the world, like worldwide, Loma Linda also has a great relation with doing volunteers for San Bernardino, which is a more underserved area. So it's very easy to sign up for these things. You just sign up online. It's a quick, just a quick portal. You just sign up with your name, your student information, and you just choose what you want to do. So everything's very well established, both mission and volunteering. So it doesn't take too much of, oh, you don't need to worry, oh, is the finances going to be right? There's a team that helps you with that and helps you fundraise. You don't have to, just use all your loan money to go into the missions. There's ways for you to fund it and have easy access to it. And yeah, Loma Linda just does a great job of just helping the community around and doing what we can to share the skills.
Definitely life-changing to do mission work for sure. These slides just represent, OT students, whatever program you go into, getting out, going to conference. We are fortunate that many of our students get to present at state and national conferences, the research that they do or their program development. One of our alumni, Emily McCardle here on the left, she actually made it into the Emerging Leaders program, which is limited to, I think it's about 30 across the entire country. So when she applied, I wrote a recommendation letter, but it's like, oh, Emily, this is really difficult. And then she's like, Dr. JD, I got in. And but she was doing some innovative work in looking at women who are working in strip clubs and helping them to get out, and the occupational needs, injustices that they've experienced, the health impact it has. And she was really creating this role for occupational therapy in that specific population. Research is also a big area for OT here in our program. All of our students engage in group research projects. Brian's involved in that right now. And we will do a formal research poster presentation, and a lot of these go on to be presented. Here on the right-hand side, you can see at our state conferences. And the topics range, it's faculty-led, so you may have some in pediatrics. I have one in spirituality. I often have one in domestic violence. It depends on the faculty expertise. Dr. Akoski, you saw him in the video, he has expertise nationally with technology, design and technology, so he usually has a couple groups. So a strong candidate, we're looking for cumulative GPA of 3.2 or higher, and then as you heard earlier, really any degree is great. We also will look at your last 60 units because we know life happens, and sometimes you don't know what you're going to go into, and so maybe some academics are a little bit lower. We look at a prerequisite GPA of 3.2 or higher. We want 40 hours of volunteer work, and this year it's been waived because we know it's been really difficult. If you have any experience as a research assistant or an aide in a rehab clinic, that's great. Include that in your application. And definitely strong interpersonal skills. I can't emphasize that enough. It's really important as you work with your clients. And then recommendation letters.
So for prerequisites, you do need a human anatomy and physiology class and lab, intro to stats class, and a medical terminology. And those first three classes, they're all offered by Loma Linda. And as far as human anatomy, I really recommend, if you do have the chance to take it with Loma Linda, it will really set the tone of the intensity of the anatomy course, because the first class that you take as an OT or PT student in Loma Linda is the anatomy, and it is it's a heavy class. So the more you could get prepared for it, I'd say the better. Along with that, you need a developmental psychology class. And for all these, you do need a 3.2 or higher to meet the minimum requirement, and they need to be taken within the last 5 years.
Okay, this really quickly, our admissions is every June, and we use OTCAS, which is the National Acceptance Application System. We have about 50 spots for the opening, so go ahead and apply. We're waiting our final decision, but hopefully we'll hear from ACO in December, and we will be offering EOTD starting next summer for application. So we're transitioning from our MOT, teaching that out and going to an EOTD. And the admissions process involves submitting your information, your applications, transcripts, references, and then we do a 15 to 20-minute Zoom interview answering specific prompts. So we hope you can join us. And on that note, I will turn it over to Dr. Valenzuela. Let me just find my stop sharing buttons.
Yeah, I just want to thank Brian. Brian was one of our stellar dissecting TAs this summer. And so when he was telling you that that's a heavy duty class, yes, but we have people like Brian that kind of mentor you into 7 weeks of 40 hours a week of gross anatomy. And this summer was kind of very different because we had to wear all the protective gear. We were the first and only program to do that in the nation, but they allow us, our administrators were quite supportive, and we had to maintain the distance, social distancing, and had to wear all the gear. And our students, they successfully finished that, even though our lab time was very limited. In the past, students could go there into the lab from 5 p.m. to 11 p.m. and then back in the morning at 6 a.m. But this summer, they couldn't do that. And so our TAs this summer were stellar because in the few hours they had the students, they just helped them get all that information, all those origins, insertions, nerve supply, actions, blood supply. And Brian did a great job. So thank you, Brian, for being a mentor to the first year's OTs and DPTs. And so you students, if you come to Loma Linda, that's one of the perks that you have, that you can apply to be a TA your second year and be a mentor to the incoming cohort. And this way, you can ask any of the TAs, you really learn your anatomy after you become a TA, because you have to teach it to the students. I've been privileged to be part of the gross anatomy team for 26 years. And if you come in this coming summer, I won't see you because I'm retiring in about 10 weeks. I'm not counting, but yes, in 10 weeks. Greener pastures. They were talking about mission work. What I'm doing is I've had 34 years of mission service here at the university, and it is great to take a small group of students, go out there to different country, different language, and be able to treat patients. And the students just click when it comes to their skills. They have all the book knowledge, but when they go out there and they make a difference on somebody, they just come all gung-ho, and the classes, they don't seem as routine, but they want to learn more. And so the opportunities for our street medicine here in San Bernardino, the students can start doing that. And then the short trips we have Friday through Sunday into Mexico, just a 4-hour drive from here. And then we have the 10 days, like I took a group to China. We went, I took 10 students in 2017, and we did Beijing, and then we went to a leprosy colony. And wow, what a life-changing experience to deal with so many amputations and with this type of students that with type of patients that we don't even see in the United States. However, our students, even myself, if I ever get a person with leprosy, I wouldn't know what to do, what to expect. But if there's something that you have a passion for, Loma Linda is going to be your place. Let me tell you one thing, no matter where you go, no matter where you go, you will finish the DPT program, you will pass boards, you're going to be a great clinician. The difference here is that in the time, the 36 months that you'll be with us, we hope that the experiences on service to others will be part of your life. So when you finish and you go out there, no matter where, you're going to incorporate that. I'm retiring, and I'm going to be self-supporting missionary in Mexico, doing the stuff that I love, where I don't have to do insurance billing, Medicare. None of that stuff is pure physical therapy. I've been doing that for the weekends for the past 7 years. I go to Mexico and I have patients that I see. I have a small clinic at my house over there. And so I'm gonna, hopefully once I'm all set up, allow students to come for a weekend, okay? So maybe if you come to Loma Linda, you'll be one of those students that can come and be part of our short mission trips. I want to give the thumbs up to your club. Last year, I went to your campus and you guys were all gung-ho because you had just gone to visit some of the local clinics and you were able to shadow OTs and PTs. And that is the best way to really get to know the field of either OT and PT. And let me tell you something, students. I don't care if you do OT, PT, speech, you will never be out of the job. You will always have a job. The biggest problem for us is that most of us have 2, 3, and sometimes 4 jobs. Why? Because the opportunities are there. For the past 7 years, I've been doing courses and evaluation for ergonomics for the Edison company over in LA and in Santa Ana. And that opportunity is great because I get to educate people in prevention of problems. You know, whenever you have a problem at home, you called and said, hey, my electricity is not working. Well, you call into a call center. Those people were getting a lot of thoracic outlet syndrome, a lot of shoulder problems, a lot of elbow problems, wrist problems. And so through education for the past 4 years out of the 7 years, they were able to have 0 incidences of people going off on medical leave and disability. So prevention is something both OTs and PTs, there's a big industry on that, okay? So the sky is gonna be the limit. Another one of my job is that I'm a certified canine physical therapist. What does that mean? That means that if you have a 4-legged puppy or a 3-legged puppy, because they had to cut one out, you'll call me and I do physical therapy for your dogs. And so to me, I went to a class in 2001, a Con Ed course, and I took a 16-hour course on that. And it was like, I gotta get that certification. So I went to school in Florida and I was able to get my certification. And so now right now I'm doing home health, but I do home health for the 2-legged and for the 4-legged. And it is great because those of you who have observed pediatrics, you will see that, you know, a 2-year-old cannot answer a lot of questions. Well, when I deal with canines, the same thing happens. the dog cannot answer the question, so I have to relate and communicate with the owner. I'm putting in here on the chat some information that I want you guys to have. Bam.
You have 2 more minutes, Professor Dr. Valenzuela, okay?
I'll give you $20 if you give me 3 minutes. Okay.
Deal.
Deal, very good. So on that information I put for LLU-DPT, check us at Instagram at LLU-DPT. You can go into our web, alliedhealth.lu.edu/PT. And then if you have any direct questions, you can contact Heather, our student liaison. And I gave you her email, hebron@liu.edu. Read up on all the prerequisites. We do PT-CAS, and in our website, you're gonna find the dates, our priority dates, and we take a cohort of 62 students, and we begin the 3rd week in June, right along with the OT students. So guys, if you have any questions, please contact us. But you are in the right path, either OT, PT, you won't go wrong, and you will never be out of a job. Promise you, Scott's honor on that.
Thank you so much for all 3 of you for the presentation. If you want, you can put your contact information, but I will be sharing that in the follow-up email. And if the students who are on this call still have some questions, they can put it in the Q&A. And if you can just stay on for another couple of minutes, if they have any questions, feel free to answer it in the Q&A. I know we are a little bit behind time. I'm so sorry, but things happen when we're having fun, right? So I want to invite Jessica and Michael on, who are practicing professionals, and they can tell you a little bit about how is work in the trenches, right?
Yeah, absolutely.
Jessica, are you still with us? I know you need to go earlier, but maybe you are. Hey, there you go.
Jessica.
You're driving.
It's okay, I'm pulling over.
Okay, thank you so much. All right, so take it over.
Jessica, go ahead.
Hi, guys. I'm Jessica. I'm a pediatric occupational therapist. I've been working now for over 12, 13 years. I have 2 little guys of my own. I have a 2.5 and a 4.5-year-old at home. I think the best advice that I can give you, I think, you know, the professors and the doctor from Loma Linda University said it, is to go out there and, you know, shadow, find pediatric clinics or hospitals or whatever it is that you're interested in and learn about it. If you're interested in pediatrics, try to find work in, you know, whether it's nannying, whether it's, you know, a school or behaviorist or anything that will give you an idea also of what typical children look like. Because I think it's, you know, it's one thing that you learn everything in school and you learn the details and the notes and all of the theories, and it's a completely different thing to, you know, have you actually experience those things firsthand, and knowing what typical children development looks like, how do they move, how do they talk, will really help you be able to flag and see what, you know, kids do when there's an issue or when there's something wrong. Right now, I work out of a private practice in Sherman Oaks, and I'm also doing some private in-home and Zoom for myself on the side. So just like the doctor mentioned, you have many jobs. I also do too. I'm also running Mommy and Me classes that I just started this past year. So I do classes based on development and sensory, and kind of give new mommies an idea of like, okay, what is movement? How do you introduce feeding? And it does it in a very play-based kind of fun way. So I'm really enjoying and having fun with that. And I'm happy to answer any questions or speak to anybody that's interested in learning more. You can feel free to follow me on Instagram or email me. I'm sure that Christina will be providing you guys with that information. And yeah, that's all I have to share.
Thanks, Jessica. To kind of follow up with Jessica, my name is Mike. I'm a physical therapist, actually practice here at UCLA Health, right down the street from campus. I've been practicing for 10 years now. I'm a graduate of the Army Baylor program in San Antonio, Texas, a physical therapy program there. I was also at, I'm a UCLA alum, so I studied biochemistry there first. My career kind of took a different path since I was in the military first, because it was a military physical therapy program. But my background after was in orthopedics, mostly in neuro populations, and finally in limb loss rehabilitation. I loved what Jessica just said about getting your feet wet as an undergrad. Really starting to shadow and getting the opportunity to go into clinics and seeing what you're really interested in. There's so many different, specializations within our fields, OT and PT. You find your own niche and just grow as a therapist. You're going to find so many different opportunities. You guys are, hitting these fields right at the right time, and you're always going to find a job, something to do. And the things are always evolving. Research is always coming out with something better and better. So like Jessica said, I'm here to answer questions about whatever you all are interested in knowing about being a professional in the field. Hopefully I can direct you in some way to make your leap into the professional career a little bit easier, a little bit less stressful. I know that school is the first and foremost, but looking beyond that, there is a light in where you will have, hopefully a successful career.
Michael, you already have a question in the chat. Goretti would like to know if the program that you were part of still exists, because she tried to research the Army PT program and apparently she couldn't find information.
It does exist, yes. I will look into it for you, Gordy, myself. I haven't reached out to somebody there for a little bit, but so Baylor now has two programs. One is the Army Baylor specifically for the military, and second, they also have what I would call a civilian program through Baylor, which is similar to the Loma Linda program or Samuel Merritt, which is not military based.
I found something online, so I'm gonna put the link in there. Hopefully this is it. If you guys can check and verify, that would be great. Students, if you have any questions for Michael or Jessica or Goretti, they are still on this call. And I believe Dr. Valenzuela and Brian and Heather is still on this call too. So if you have any questions, anyone, you can put it in the Q&A or chat if that's easier.
Absolutely. I will leave my email address as well.
I'll
like
put
I said,
it in there.
Oh, great. I graduated from UCLA, so I have a deep down, I'm a Bruin. So I can't wait to help any of you guys get to where you want to go with, especially if it's in the physical therapy field. I know what it's like to be a student there. I know what it's like to just kind of try and figure out where you want to go. I mean, if physical therapy is right for you, are you thinking about another health profession? What is it going to take to, overcome those last years of school and finally just make the jump into either program? It's an exciting time. And I'd love to, if you don't, for whatever reason, want to ask questions now, if you feel more comfortable just typing them out and sending me an email, please don't hesitate. I want to make sure that you have all of the information when it comes to, setting yourself up for a successful career.
Any advice from any of you on how to get hands-on experience? That's the most common question I get from students. Michael?
Well, I can answer
okay,
that.
Go ahead.
As a student who's trying, so a lot of our members are actually trying, and the best advice we give them is just to email all of the clinics in your area and just ask them if they have openings for like volunteers or even like aides if you have experience in clinics already. So yeah, just keep trying. Like a lot of the times they're busy or they're not accepting volunteers, especially during this time. But I know a lot that still are, just with like COVID precautions.
Yeah, thank you, Gordy. Kind of nailed it. It's been tough. So I can only speak for our hospital clinic here at UCLA. Because of COVID, because of precautions we're taking, we've actually suspended our volunteer opportunity in the hospital setting. I'm hoping, fingers are crossed, that changes as time continues to go by, and that we get our volunteers back in here. We've had many rehabilitation volunteers come through our clinic who done many hours of volunteer service and have gone on to apply to programs. So we do have a volunteer program here. If you're interested in applying when it's up and running, you have to, I don't know the link, but you apply to UCLA Health system as a volunteer, and you start the onboarding process, and then you request rehab services, and you'll find your way either to our clinic here at in Westwood, or we have 2 other clinics in Santa Monica affiliated with the Santa Monica hospitals as well.
Quick question. Do you guys do telehealth by any chance?
Who specifically asking?
Like, I'm just curious because sometimes students, like the medical school students, advice for pre-med is to maybe shadow telehealth appointments. I just don't know how those work, and if they do for physical therapy. Do you guys offer telehealth at all?
Yes, we do. I mean, it's a new normal for us. It's not the way any of us were probably trained. There is a small group probably that saw this kind of niche field and we're like, oh, I can go into people's homes without actually being there, and had the advantage going into this. But yeah, this is a new normal that we've had to kind of jump into. We offer our patients video visits, telehealth, for more than anything, just comfort, safety of being able to rehabilitate, be able to reach your goals without really stepping into a clinic, and doing things safely. Now, to answer your question about shadowing video visits, I don't necessarily think that's an option right now at our clinic, just due to HIPAA situations.
Thank you. Any other resources, even podcasts, videos?
I'm curious
reading
if anybody out there is typing their answers. Do you all listen to podcasts about physical or occupational therapy? Who are you guys listening to? What are you guys reading? Who are you following on Instagram? I'm curious. I'm 10 years into this, right? So when I started, there was nothing, no social media was going on. You guys have it a lot easier to connect and stay up to date with the latest research, stay up to date with what's going on in our field. And I'm just curious, who are you guys following? What are you guys doing social media wise?
Gordy, any input on that? Because I've heard that students are listening to podcasts that are professional related.
Yeah. Personally, I'm in a pre-med, pre-health frat. So I know it's very popular for like doctors and nurses and like other healthcare professionals to make TikToks, if you've heard of that. And I know a lot of people are following that. But personally, I've seen one OT TikToker, and all her TikToks are about like getting the like profession out there, because not a lot of people know about it. Yeah. So yeah, that's all.
I'm curious, Brian, if you're still on the call, I'm sure you have some insight as a student now, you guys are probably following people, things like that, right?
Yeah, but I haven't, not with like TikTok or anything, because I'm not as young as my other colleagues. I'm like the oldest guy in the cohort. I guess I'm not old, but I'm like 30 years old, so I'm not into TikTok as much. But but like on Instagram, just some random like before I was coming into OT school, I'd follow early intervention, like technique, like OTs that would show early intervention techniques and things like that, and a lot of just like early intervention care. So it wasn't even OT, it was just like how to care for kids with this kind of condition and that kind of condition. because I am interested in pediatrics, and I was working in a pediatric clinic 2.5 years prior to school starting. So it was just that, but nothing in particular.
Yeah. No, I think, so I can only speak from a physical therapist standpoint. There are a lot of great things now on Instagram, and particularly since COVID has kind of isolated us all, on the flip side, it's kind of brought our community a lot closer because we can communicate so effectively through social media. I will email Christina some of the people who I feel are, in the field doing some wonderful things with physical therapy, with rehab, primarily sports rehab. These are the ones that are training, professional athletes. So the higher level athlete. And then there's also those that are treating patients who, just their goal is just to be able to walk 20 minutes, with their grandson. They want to take their grandkids to Europe to walk, in Italy, or you're the pediatric patient who, the parents are just can't wait for them to just roll over. So I think, finding, people to follow on Instagram is great, because it gets you in that mindset of where you want to go as a professional. You start latching on to these ideas of the professional, what they're really striving for, and it kind of puts you in that mindset of what kind of clinician you want to emulate and then surpass.
I just want to let you know one more thing, that in normal time, even the UCLA athletics department have sports medicine internships for students. My understanding is that it's a pretty significant commitment. It used to be a 2-year program. I don't know, Gorady, if you have heard of it, but I know that a lot of physical therapy, pre-physical therapy students have taken part in that, but I just checked the website, and of course it's not running since there is no athletic training or much of those going on at the moment. But just keep in mind that sometimes even through the athletics department, you can have some hands-on experience with athletes rehab. Gorady, do you know about
a couple of our board members, they couldn't make it today, but they're actually in the program. I know you have to apply by the end of your first year, and they look at all your GPA stuff from high school and your first year of college. And it's a very rigorous program, like you said, and they get assigned to one UCLA team. I know one of our board members does the football team and one does basketball. So you gotta be very up close if you're interested in PT. And yeah, it's a really good experience. It's just really intense, and that's all you hang out with.
Yeah.
Yeah. But they like it.
Yeah. All right, Michael, would you be up for informational interviews if some of our students would be interested in reaching out to talk to you?
I left my email address in the chat just right now. I'd love giving back to my community and want to help all those just trying to do great things. I know somebody out there in this chat room right now is destined to be the best rehab professional out there. So let's make that happen and continue to grow our fields.
Well, we are 7 minutes over our time, so thank you so much for bearing with us for these extra few minutes. I really enjoyed and learned a lot about your schools, your programs, and also the profession. Gorady, thank you for representing SPOT. Hopefully you get some new members. Students, please, if you have any questions, feel free to reach out to any of us, me included. And thank you so much for spending your Tuesday afternoon with us.
Thank you, guys.
Bye, everybody. Bye.